So welcome to this PRCA Public Sector Zoom. This is the second such group event that we've done. For those of you who don't know, my name is Chrysostomou. I'm the chair of the PRCA Public Sector Group. With me also are a cast of wonderful people, and I'll ask them to introduce themselves in a moment. One notable person is Carrie-Anne Wade, who's my vice chair on this group. As I say, this is the second meeting, and we will have other events taking place in the future. Clearly, we've all been in a challenging time at the moment with coronavirus, COVID, and the premise of discussion is around do we feel the crisis is still ongoing, or are we in recovery? And my exalted guests are here to challenge, offer their opinion and views and their experience. And what I'll do is ask them all to introduce themselves. Just some rules of the Zoom. I'll be speaking to my panel, obviously, and then we may find some time at the end to take some questions. If you have a question, I'll ask you to put that in the comment box, please. Otherwise, could I please ask you all to have your mics muted? Kira, is there anything else to add to that?
That's it. Thank you.
Thank you. Thanks, Kiri. So I'm going to work around depending on who I can see on my screen. So I'm going to ask for introductions. So Carrie-Anne, you'd like to start?
Hi everybody, I'm Carrie-Anne Wade, and as Marcus said, I'm Vice Chair of the Public Sector Group, but my day job is Director of Communications and Engagement at North East London NHS Foundation Trust. We're a mental health and community services organisation with a little over 6,000 staff spread across 200 sites, and we work across 4 London boroughs and Essex and Kent, so a little bit about my organisation.
Thanks, Kiri, for helpfully putting that list up. So I'll go to the next person on that list, which is Simon. We've got 2 Simons, so I'll say Simon BB.
Yes, I'm Simon Butt-Bethlendy. I worked for over a decade in higher education in the in universities and as a consultant, and during that time I was chair of the CIPR Education and Skills Group, which is the sectoral group for education. I now work at IOSH, which is the Institution of Occupational Safety and Health, the world's largest professional body for safety and health. So we're involved in this situation, the pandemic, in a number of ways, but our members, 48,000 in 130 plus countries, are obviously at the forefront of keeping workers safe and healthy throughout this, and helping people to readjust to very strange ways of working now.
Thank you. Claire?
Hello everyone, my name is Claire Pimm, and my job is the Director of National Resilience Communications at the Cabinet Office, but I've been a public sector communicator for more years than I'm going to confess to, but I've been running the communications hub at the Centre of Government's response to the COVID outbreak.
Thank you, Claire. Simon?
Yeah, hi, afternoon everybody. I'm Simon Jones. I'm the Executive Director of Communications for Westco, which is a public sector communications agency. I think the best part of my job is the fact I get to support lots of different councils in my role. I've just finished as the interim AD, Assistant Director for Comms, Policy and Performance at Oldham Council. And before joining Westco, I led communications at Hammersmith and Fulham, Havering and Wandsworth councils.
Thank you. And Amanda?
Hi, yeah, Amanda Coleman. I am now running a crisis communication consultancy. Just had a book published on crisis communication, and for 20 plus years worked in the public sector in police communication.
Thank you, Amanda. So as you can see, I've got a great cast here, and they've got tons of experience behind them. So just to kind of kick off, really, so just reiterating what I was saying earlier on. I've worked in the public sector for quite some time as well. I'm actually older than I look, and that's included local government and national government. I've been involved in a number of crises in the past, and that's everything from the London bombings, fire strikes, and a whole raft of other crisis incidents, one-day crisis, and major ones as well. Personally, I've never been involved in something like this, which is the pandemic. So I'm sure, like many of you, it's been a challenging time for us. And I suppose we did a session a little while ago, and Carrie-Anne and I are actually talking about our experience up to that point, which was about a month ago, of managing the crisis. And now things have moved on massively, and it's great. For example, we've got Claire on here as well. We can talk about from the government point of view, but things have moved on, and many people might start observing, especially the public, that things are starting to release slightly and they can get out there a bit more. And we had the wonderful newspaper titled Super Saturday quite recently. But I suppose my first question is going to be, and I'll go to you, Amanda, is are we still in a crisis, I suppose, is the first question. What's your opinion of that?
Yeah, I mean, in a nutshell, yes. It's a difficult one because we're in a position where the crisis is still ongoing and some people are moving towards recovery. But as with personal experience of living through the pandemic, it's a shared experience, but we've all had our individual circumstances. So we've all had an individual experience. Organisations are going to be the same. So some will be that much further ahead than others, and it's very much dependent on a lot of factors. I think the challenge the challenge communicators have got, is recognising where they are on that trajectory and actually tailoring the communication accordingly. Because if you're not careful, you'll start to be in the recovery end of communication when the people you're talking to are much further down and still in the crisis end. So, and at any point, when you're in the recovery, as Leicester's shown, you can be back into a crisis. So it's a very complicated and challenging way forward, but it'd be certainly not through it, because things are still happening, quite serious things are still happening.
And that's the challenge, isn't it? Because I mean, I'm working at a local authority as well, and you start to get into that recovery point, but suddenly, like Leicester, you have this spike, and people have to react really quickly to that, don't they? And I think some big lessons have been learned. I know, Claire, you would agree that there's some lessons that we've learned from reacting to Leicester quite in dealing with that as a crisis that's suddenly come out of nowhere again.
I don't think we should see Leicester as a crisis that's come out of nowhere, if I'm honest. The fact is that this virus is still very much alive and out there. I mean, yesterday 127 people died. And that's 127 people, let's not forget that. So this is very much a virus that is still alive, it is still out there. We have to learn to coexist with the virus until there's a permanent vaccine. Then we're going to have to learn to coexist with it. And part of that coexistence is being aware of what its prevalence is in the community and in the variety of ways that it can spread, be that community or work-based. And so there are obviously public agencies who are monitoring those levels of incidence in the community, in regions, in local authorities, etc., and keeping a very close watching brief on those. I think Leicester obviously it feels very significant. It's the first local lockdown that we did. We'd obviously had outbreaks in Anglesey and in Wrexham and in other, particularly in health settings, etc. But Leicester was the first local lockdown. And I think we'll have to learn a lot from it. We have this ambition to move towards what we're calling smarter lockdowns. And I think, this will have been our crudest lockdown because it'll be the first one we did. And there will be lots of learnings from it about what worked, what didn't work, and how we make it better next time, and also how we can intervene earlier so that actually a lockdown is the extreme end of the spectrum, and it's actually about how we can intervene earlier, but very much working in a very, sorry, cliche time, but multi-agency way to make sure that we're using all of the comms levers, channels and resources at our fingertips to be able to communicate with the people who live in those areas.
And that's the point, isn't it? And that's why I made that slightly flippant remark, because actually we're not out of it, and that's our challenge, is making sure that the public realise that. Back to my point earlier on about Super Saturday, when people are starting to let their hair down a bit, but we still have this kind of ominous presence that might suddenly flare up again. Carrie-Anne, from an NHS point of view, what's your opinion?
So I definitely agree we're still in a crisis, and I think the challenge for not only the communications workforce but the wider NHS workforce is how long that's been sustained for. So I think people have had experience of working in crisis situations where the crisis happens and there's a period of time where you're dealing with the crisis and then moving into recovery, but that, you know, we're 4 or 5 months into this now, and it feels like one of our biggest challenges goes back to the point that Amanda made about understanding where people are in terms of the crisis. So organisationally, I feel like my organisation and the wider NHS is very keen to start moving into recovery mode, but it's understanding what that means, because COVID will be with us for some time to come. So we're not going to be moving back to exactly how everything was pre-COVID. But also we have to realise, for example, in my organisation, we've got staff members, we had over 500 staff members redeployed from their substantive roles, and 300 of those are still redeployed, supporting what we would call critical services. So actually that group of staff are absolutely not in the mindset of recovery. They're still in that real, I'm in the thick of the crisis mindset. So I think that brings lots of challenges, particularly from an internal comms point of view, about how and what you message to people. And absolutely agree with your point that the public are obviously seeing an ease in lockdown measures and being able to return to some sort of normality, whatever that may look like. But for us, it's about, you know, how are we talking to our patients about which services it's absolutely okay for them to access, which ones we're still not running fully because we've got people redeployed. So it just feels really, really complex and like a challenge that, you know, many of my team from a comms point of view have never really had to face before.
And that's absolutely it, isn't it? Because you know, residents, the public will expect certain services start becoming available back, you know, business as usual, as we say. And actually, we'll probably argue that we're not exactly there yet, are we? Simon, what about from a local authority point of view?
Yeah, I mean, I agree with everyone. I think it feels to me like we are still in more in crisis than recovery. In my old patch in Oldham, we've seen a kind of 108% increase in unemployment with 6,000 new claimants, a 5-fold increase in people using food banks, huge increases in youth unemployment, rising referrals to social care because of the number of families experiencing problems. And when you look at those figures, I think it's hard, and they'll be replicated everywhere. I think it's hard to say that we are in recovery because the experience of most people, for many people at least, is one of crisis. Having said that, you know, and kind of where I agree with the rest of the panel is that I think from a traditional emergency communications point of view, the phase that we should be starting to think about is more around building the foundations for recovery, i.e. being less reactive in terms of our day-to-day communications. And we certainly had a significant period of reactive communications. But now I think we should be much more in a proactive mode, and that is around laying the foundations and supporting recovery and all the things that we've just been talking about there. That's where I think, from a local government communication point of view, we're at the moment.
And I would agree that I mean, I've seen the work change in the team from, you know, the outright crisis we're dealing with to more around start looking at that recovery. But I absolutely agree with that point that, you know, it's a long-term, you know, recovery could be something that's going to go for quite some time. You know, we think about the impact to our high streets, you know, long time care and support for people who, you know, were maybe extremely ill from COVID. So there's going to be a long-term, you know, there'll be long-term effects, I'm sure. The other Simon now. So I know you do talk to lots of other organisations as well. So what's kind of been the mood music from them? What have you learned from them?
I think it varies a huge amount. I think, agreeing with everyone else, we're in a strange kind of hybrid crisis where people are at different points. And obviously the other thing that is a factor is that your work life it bleeds into your public life. You know, we're living at work now because, you know, we're working from home, many people, but not everyone. Obviously there are tensions even within households and workplaces, the economic tensions. What we're doing as an organisation is we have members in many different parts of the world as well, and links. We've been doing work since the beginning of the crisis, looking at this in phases. We started in I guess, a crisis response to COVID, getting our members' voices out around the kinds of safeguards they were putting in place to protect employees, to protect their supply chains, to reduce the infection rates, and that's moved into a kind of look at recovery and solutions, while still keeping an eye on the re-emergence of virus in other parts of the world, and the fact that, for instance, our members in Africa, are still struggling, still trying to, in different parts of Africa, trying to hold the infection rates at bay. And so we're having to keep your eye on lots of different situations and be very sensitive. And we had a webinar some weeks ago about mental health and well-being, and the HSE's senior psychologist Peter Kelly said, and guests from Mind and other institutions said, that there is a parallel pandemic of psychosocial impacts, and obviously Carrie-Anne and others will know that for their employees, there's this is something around post-traumatic stress and secondary trauma, and these are going to be affecting people, and then they'll be affecting families as well in different ways. So I think it's highly complex, and for the communicator, we have the opportunity to get good information out, to keep to take the temperature of all of this, and to respond appropriately in many different ways, using all of the channels that we have at our disposal.
Amanda, talking of, obviously you was at Manchester Police following the Manchester bombing, and I think especially the mental support that was on offer, that was really important, wasn't it?
Yeah, it is a really, really important element, and it's something I focused a lot on. I think the challenge is the sheer scale of it. In the aftermath of the arena, it was something like, in the first sort of year, 18 months, something like 10% of the workforce had needed some kind of support. Which, when you consider, obviously you've got the people who are immediately there, but it was all the other roles people were doing. I think what you've got now is we all have got lots of issues that we're trying to deal with. So it's not just that employees are in certain roles or in certain areas of responsibility are facing issues. The challenge is, from a policing perspective, if you had a member of the team who had a direct connection with an incident or an issue, you'd move them away from it and give them the time to go and do what they needed to do. The problem we've got is that we're all involved, that you can't step away from it, and that creates an extra layer of challenge for anybody who's trying to do communication, because you've got so many things that, as long as all the work things you're juggling, you've got so many personal things that you're trying to deal with as well.
And I think Carrie-Anne, you were saying a similar thing, wasn't you, about the fact that people are in different roles, and I know the same of where I work. We've moved people who are in roles that are not. You've stopped particular things like closed down libraries or whatever, and you've mobilised them to do something else. And actually, that is not something they ever expected to do. So, from internal comms point of view, it's quite challenging to kind of support them, isn't it?
It is really challenging to support them, and I think one of the things that my team have really been trying to do is to offer those people the space to be able to share their experience and stories in a way that's safe for them and that they obviously feel comfortable with. But just you saying that was reminded me, we've shared some staff experiences with our board members, actually, because I think they felt quite far removed from what's been happening on the front line, as it were. And we had absolutely just the most amazing speech and language therapist who works with young people, who has literally recently qualified and has been moved away from that job to work as a healthcare assistant on an inpatient ward with patients who are being discharged from the acute trust who are potentially COVID positive. And just hearing her experience, I think something that we have a responsibility to do as communicators is to really try to tell those people's stories as empathetically as possible, and the good and the bad of those stories, because actually there's so much learning from those people who've been redeployed into roles that they've never ever had to experience before, that if we don't find a way to capture, I think it will make recovery really difficult for us. But you know, all sorts of different feelings, people feeling guilty that they're stepping away from the role that they were trained to do, and people feeling guilty when they've stepped back away from their redeployed role because they're leaving their new colleagues somewhere. We've had staff who've had to shield, who would normally be clinical frontline. Again, I think there's just that tremendous sense that everybody's wanted to play a part in managing the crisis and managing the pandemic in whatever way they can, but have been really challenged by the points that Amanda said. You know, it's not just your working life, you've got everything else going on at home, caring responsibilities, potentially family members who've got COVID. So there's just so much complexity in terms of kind of the offer that we need to give people, but part of that offer, I think, needs to be the space for people to share how they're really feeling and what their experience has been.
Yeah. And Claire, I suppose, as part of your planning, looking ahead, I mean, you know, like every other organisation, you know, the government's a massive beast compared to, and you've gone through all this in a larger scale than many of us have. And so, how does the government manage, you know, the comms aspect and the kind of remobilising the staff, and I suppose, have you had an opportunity? Because I know I have, you know, currently reviewing the impact it's made, and actually we've learned some really valuable lessons from this as well about how I think we need to, as a team, continue to communicate. So have you also learned some valuable lessons that will impact on the way you continue to communicate in the future?
Oh, absolutely. And I say to people, I feel like I've never been on such a steep learning curve in my career as I have been over the last 5 months. In one way, it's felt like a marathon, and in many other days, I felt like I only blinked before it started. So yeah, it's been a really fascinating and a really humbling experience setting up and running this hub. And I think what you find in the start of a crisis is everybody just is willing to give and to share, and people mobilised in and really, really, really wanted to be part of it. And people gave, and are still giving, if I'm honest, so much. You know, people wanted to be part of this and wanted to make it work. I think what we're feeling a bit of now is that obviously as this business as usual drive and all the other things, because the rest of the world and the country carries on, that people are now being pulled back to their day jobs. And how do I sustain this hub, which is, I will be sustaining this hub for another year, because we need to continue to coexist with this virus. Those of you who work in the health sector all know we're already thinking about winter pressures, etc. All of those people who didn't go for their care or their operations during this period because they didn't want to overwhelm the NHS, you know, we've got to factor all of that in. So we're already at that stage of looking forward and react and planning, so scenario planning. I think what has been amazing about running this hub is kind of being able to set up this centre of excellence. And so what I've been able to do is bring everything together into one co-located space, which has enabled a really fast, iterative response. So, you know, everything from in this hub has been, you know, press and rebuttal, digital, public data. So all of those slides you will have seen at the press conferences every day, I got in some clever people who understand statistics to produce them. Obviously paid for marketing, low cost marketing, support to businesses, working with partners, influencers, etc. External relations, strategic comms, obviously, liaison across the devolved administrations, an international team, people looking at dis and misinformation, because some of the stuff that's going on out there is absolutely fascinating, as well as having a project management office who've helped me do all the, you know, the finance, the HR, the admin, the PQs, all of that. So it's been amazing to bring all of these brilliant people together, and I think we've all learned. And I think some of the things we've learned is about that co-location, about that iteration. We've always been doing insight and evaluation at real pace, and how you feed in that stuff very quickly to the right people to get, you know, the right decisions made. And that kind of iterative, fast response has been amazing. But also that, you know, listening to how people are thinking and feeling, and not kind of sitting in your office bubble, but actually understand how this impacts on people. And I think that's the other thing that's been incredibly humbling throughout this. I mean, I used to work for a mental health charity, but people have been working and doing their role whilst also managing their caring responsibilities, homeschooling of a state. Well, I'm not even going to talk to you about the homeschooling that's gone on for my daughter, but actually people have also been dealing with people who've got sick. People know people who've got sick. People know people who have died. People have had to take time off to attend a funeral of a family member that's died. And they're coming in and dealing with it as a work professional, but also dealing with it as a human being. And personally, I have a very close friend whose sister's been in Lombardy and went into hospital very early in March, induced coma for 2 months, stroke, wasn't sure she was going to make it. And then last night I got a picture and she's out of hospital. So I feel like she's been on the journey alongside us. But I think there's a lot to learn about that kind of hub model, that working together, that integration of these communication and supporting functions that enables us to iterate our comms very quickly, get things out the door very quickly, and also understand how people want to receive information.
Yeah, and that's really important, isn't it? Because we've got that continual challenge of ensuring that staff, the public, residents, etc., get the information they need. And I know it's been, I mean, I know from my point of view that, you know, one of the big statistics on this are BAMI communities suffering more overtly than other communities. And, you know, it's highlighted some issues around communications, isn't it? Because, you know, making sure that we're reaching those groups and getting us to kind of review how we do talk to these groups and make sure we've got the information there. We'll maybe talk about that a bit more. Is Simon Jones still on here? Sorry, I've lost your face, Simon. Just wanted to get your...
Yeah, hi Mark, I'm here. Don't worry.
Oh,
sorry, I did dip out for a second with a local outage, but I'm here now.
I just wanted to hear whether there's any lessons you feel that you know, colleagues at local authorities have learned through this process from a comms point of view.
Yeah, well, I think one of the lessons is the thing you just spoke about, which is about kind of needing to really kind of reach out and target different groups in different ways, which is not something perhaps we've been very good at in the past, but that ability to really kind of connect with different networks, particularly with BAME communities, for example, and to use kind of the community influencers much more in order to connect to their own networks as well. And I think COVID is kind of one of the positive things. It's got us to think much more intelligently about how we can do that, to be much more targeted, to move much more into a kind of community engagement arena alongside communications in order to effectively reach out to different groups in different ways. And I think we're kind of still developing our maturity around that. But I think the community networks and intelligence that many local councils have built, certainly over the last few months or so, puts us in good stead. I think the second kind of lesson for me from a kind of local government point of view is perhaps replicating what Claire's been talking about, but doing that locally as well. Many of us have kind of worked in a hub type environment in our local areas where we've become much more kind of integrated, particularly with public health colleagues, in order to ensure that we can react quickly, that we can do the local intelligence gathering, and to be very highly responsive in terms of the type of measures that we need to deploy. So I think they're the two things really for me. One is around integration in terms of a hub type model, and the second bit is moving more into the kind of community engagement arena based on the ability to connect with different networks and different groups in different ways.
Yeah, so the other Simon, are there any observations or learnings you've picked up either in what you're doing or in talking to all these other organisations?
Well, we're seeing a huge appetite now for more information about risk assessments, about becoming more risk aware. This is something that we obviously advocate, but you know, never before has health and safety become so vitally important and well understood. I mean, PPE was barely known about in many settings up until recently. Now we're all, you know, wearing face masks and that kind of thing, and far more in clinical settings. And then there's lots of changes to the logistics, I suppose, of workplaces. You know, split shifts of different kinds, all the physical separation, all the control measures. So what we're finding is that we need, as Simon said and others have said, to work out new ways of getting this information out there. We've adopted a bit of a hub model as well in creating lots of new free content that's then been shared in partnership through other professional bodies, and that power of networks is important. So this is where professional bodies, for instance, can be very powerful, because you've got a huge network of practitioners, a huge network of champions who can take standardized information and share it widely and then reshare. And I think that's another, the idea of content partnerships, for instance, across organizations that can reach the right touch points, the right and the use of influencers. It's all very important. And I think communications is evolving and will evolve very rapidly because of this.
Amanda, did you find you had to change the way you communicated, or did you have challenges about sort of almost like different track approaches of getting the message out there?
What, for this specifically?
Just thinking about Manchester Bombings game.
After that, I mean, yeah, there was huge amounts of learning, which is why I ended up writing the book, to be honest. There was so much that we learned as to how to approach things. I think the critical bit is the need to now move into engagement and not broadcast, because all the crisis bit at the start is all broadcast, and like everybody's been saying, it's not sustainable. So it is a huge challenge, and I think to a certain extent, with the way things are, you almost have to start with a blank piece of paper. Yes, you know what you've used in the past, what worked well and what might not have worked, but you need to approach this with a really open mind, and I think that's sort of mirrors where businesses are as well. That they've got to redesign and make themselves fit for what comes and how things might be in the future. So my other thing is, you can't expect to just keep doing comms in the way you've always done it. It's not going to be sustainable, and I've not been a particular kind of risk advocate for we used to manage a lot of risk working in the police, but I'm with Simon. Actually, yes, organisations are recognising the need to manage risk. Communicators are in the same position. You've really got to get a handle on what the risks are that you face in communication terms and find ways of dealing with it. It's a different world for a lot of people, but it's important to be on top of that if you're going to be able to move forward.
So, man, just on your point about blank sheet of paper, I mean, I know in the past, I quite often speak to emergency plan officers, for example, and they say, "Oh, we need a plan for everything." And so, are you suggesting that actually, because in my opinion, you can never 100% plan for every emergency, and there's always going to be that learning along the way. So, do you think it's still worth planning for emergencies? Because clearly, the pandemic is something completely new to us.
Yeah, I mean, I could talk endlessly, so I won't because I'll apply things. But yeah, I mean, what you need is a framework plan. What you need is an approach. What you need is to know what you will do, and then you tailor it according to what happens. But if you haven't thought through the risks, if you haven't looked how you're going to mitigate the risks you might face on a regular basis, if you haven't then done scenario planning, then of course you're going to get to this position where everything's going to be a shock to the business and a shock to comms and a shock to the system. Mm-hmm. So absolutely, that's one of the things I say a lot is you've got a plan, and it's hard at the minute because we're living with one crisis. Doesn't mean others aren't going to hit. We've already seen cyber attacks. We've seen all kinds of flooding in different parts of the world. You've got to still be on top of things, and it's not easy when you're juggling so many things already. But you've got to be prepared for the next crisis, and that's why debriefing and learning is so important all the way through.
Claire, I'm sure that's something that you obviously have to tackle as well, especially in your role. Thinking about what I mean, there's a long-term impact to the economy and other such things from this, but the potential that something else might come along.
Absolutely. So, I mean, we have, exactly, and it's exactly what Amanda's right. You do as much planning as you can as possible. You get as many of the tools in place as possible. You keep doing the learning, the iterating, get your processes in place, because then you can put your brain capacity to reacting to the specifics of what that particular crisis is. We are working on the moment on what I'm calling the Toblerone strategy, because that appeals to my heart, which is we're working in a triangle at the moment. And the 3 points of the triangle are the three things I need to worry about, which are, one point is obviously health, second point is the economy, And the third point is society, and all of the interventions and the activations we need to do has got to calibrate in the right way and at the right point against those 3 points. So we're working through the next stage of our strategy. They've always kind of been our 3 defining points. We've obviously been very heavily around health for absolutely accurate reasons, but through this next period we need to be measuring and reacting accordingly and putting in place the appropriate strategies and communications and interventions that are around those other 2 points of the Toblerone. And they gave me a Toblerone as well to say that this had landed.
So Carrie-Anne, have you seen that as well? I mean, it seems to me also from this conversation that, you know, different organisations are at different levels of, you know, being in crisis or recovering. Just going to that point about planning, I mean, where do you see yourself in that kind of planning cycle? And also the same question to you, really, you know, you try and plan for something like this, but, you know, were you able actually to fall on your plans, or was it just like blank sheet paper again?
I think it was a mixture of both at the start. So I would say that from a communications point of view, we've always worked really closely with our emergency planning team. When I say team, it's 2 people, so I make that sound really grand, but my emergency planning colleagues. So we do always run regular exercises from a comms point of view about if a certain sort of emergency happened, how would we respond to it. But I definitely think it felt a bit like you've got the plan, but do you ever really look at it when it actually happens? And you do kind of just muddle through and make the best of things. The one thing that I would say I've been really surprised and pleased that my team have done is that regular learning and the evaluation throughout. So actually one of my biggest comms bugbears probably pre-COVID was the fact that, you know, particularly in the NHS, we talk a lot about evaluating the activity we do and learning from it, but whether we actually do that evaluation or not is probably a whole other webinar. But actually my team have done really well at evaluating the actions and activity that we've put in place from a comms point of view, and then been adjusting throughout. So whether that's been the regularity of comms, the different channels that we've used, we've set up new ways of communicating with our leadership team for the rest of the organisation. But rather than just assume, right, we're going to do, you know, a weekly webinar now, we'll do it for a bit, we'll get some feedback, and then we'll adjust what we're doing based on the feedback. And I've almost been surprised that in the midst of trying to manage through a pandemic, actually quite a lot of the things I would have liked my team to have been doing before, they've been able to implement now. And that definitely will make us consider differently what we do into the future. There's things that organisationally, our staff in particular, are feeding back they'd like us to keep, you know, when we're out of what feels like the crisis at the moment. So they've definitely said the leadership team feels more visible, for example. So all of the tools we put in place to enable that to happen, we'll want to keep into the future. We have started planning for recovery. I think the challenge is just around the governance and the structures and the calls on people's time. So our new recovery structure has a number of different subgroups, all of whom would love to have a communications rep sitting on them, and all of whom I can't give a comms rep to because I just don't have that resource. And it feels like the complexity now is just managing the expectations and priorities that are being put onto my communications team. So we're still running command and control. We've still got at the moment 2 comms people in incident management team structures. We've now got the recovery stuff taken off. That's going to require a lot of comms resource, and we've got the business as usual stuff creeping back in. So it's my job to have conversations with the leadership team in the organisation to say we have to be really clear what the priorities are here, and if we're deeming it not to be a priority, then it's okay for my team to say they can't support that right now.
Yeah, that's really important, about understanding those priorities. Simon Jones, I know, I think that evaluating is really important. Evaluation of kind of both the impact of our comms on staff, but also on residents is really important. I think Westco have been doing some research, haven't they, around that?
Yeah, and I think one of the really important parts of recovery is really kind of almost resetting our knowledge around how, you know, community perceptions, attitudes. So what are the new social norms? Because I think we do need to deep dive into that to get that kind of insight around what people think, what they're prepared to do, what their changing circumstances are, changing perceptions, changing attitudes in terms of how they want to engage with local public services. All that's going to be really important, I think, in terms of getting that insight to help meaningful recovery, particularly in areas like behaviour change, where we have to become much more sophisticated in how we communicate and connect and engage with local communities when it comes to long-term compliance with things like social distancing, etc. We've kind of moved, if you like, from a kind of very much a broadcast command and control, almost instruction or order by government when it came to compliance, which is really effective at the start based on the level of risk. But as we move through into what's going to be, you know, a long-term situation here, we have to, I think, adapt to that now and become much more sophisticated in the way that we communicate, in the way that we engage with communities around these issues. And the starting point for that has to be developing insight around what people think and their attitudes and perceptions. So we have been doing work in Westco around that with a number of local authorities. And that insight that we get from that is going to be invaluable in terms of how we then kind of reposition ourselves, if you like, in terms of the way that we engage and connect with local audiences.
Yeah, thanks. And I know there's a couple, just on questions actually. I'll go to Simon, the other Simon next, and then I'm very happy to start opening for questions. But before I do that, I will jump to Claire, because I do know that you've been running focus groups as well, haven't you, Claire? So Simon, are there any other thoughts or opinions based on what we've just been discussing?
Just a quick one, and this is where I think PR and communications is kind of aligned with health and safety and well-being. I think we have a chance to build allies from the line managers in workplaces and many of the supervisors and the influencers in various settings who can help us to communicate better, to reach further, and also to get the right kind of information out. We published a survey this week with YouGov that found that a small, you know, a fifth of employers have had no health and safety training, don't really know anything about health and safety, and then across organisations the opportunity to meet your kind of duty of care and provide a safe, healthy work environment, which of course now is more important than it's ever been. You know, that's compromised therefore. So I think that again, it's about building the right sorts of alliances throughout organisations, and maybe communicators drafting in people to be champions in different ways. So I think there's some new opportunities as well for new models of communications and engagement.
I think all of us have become more cognizant of our own health, and I mean, I know I've become more aware of the health of my team as well, and the organisations, you know, and all these new things that you have to be aware of around PPE and being safe out. So a massive impact to how we work. Just jumping back to you, Claire, you mentioned the 5 things, and I know that the government have been running focus groups as well, haven't you? Been testing messages and getting that feedback from the public.
Yes, I mean, running focus groups is kind of part and parcel of our bread and butter. It's what we've been doing for years. And I mean, personally, I find them one of the most amazing things to be part of. And to, I mean, we run quant, obviously, and you get numbers and you get statistics and you interrogate them, and they're very interesting. But when you do focus groups, you get the colour and the depth and an opportunity to probe, and what might be a presenting kind of issue. When you probe beneath it, you understand there was something completely different. We've used them obviously more frequently than we would normally do during this period, to find out what the issues that people are feeling, what are they responding to, what do they need, how are they interpreting the information. And from a comms point of view, it's been invaluable, because you think what you've written or the source of support you've just developed is absolutely crystal clear. And of course you share it with someone and they take a different understanding altogether. So the chance to iterate messages for different audiences and to test them with real people and to see what is taken out of it has been really invaluable. And as I say, we do produce this 5 things we've learnt this week document, and we pulled that from all different sources, you know, that whether something we've done has failed, something we've done has gone well, or whether what the research is showing us about changes in different mood. Obviously, we're tracking how certain announcements and interventions go down. But we share this. I think that's the thing, is that we produce it and I circulate it on a Friday afternoon, and it goes to the very top of the tree. So there is an exposure there, particularly when things are failing. But I think we have to show that we're on it. We are iterating. Not everything you do under pressure, and not everything you do is going to work anyway. So what are we learning as a result of that? And I think, let's fail fast. Iterate quickly, and make sure that what you're doing next week is is better. And if every week what we do gets better, then I'll think we're moving in the right direction.
We're all human beings, aren't we? We've got a question here from Darren Binlos. So you say, I think all agree we're still very much in crisis. So that's a question I will ask, whether we think we're in crisis or are we moving to recovery. But I think I'm starting to get the gist of where we are on that. What does it mean for messaging, given recovery is so fragile and conditional? How do we ensure that our message reflects crisis, but not alarmist, and support recovery? So, has anyone got an answer for that question? Let's give it a go.
I don't mind stepping in with some initial thoughts around that one. So I think it's about, I actually think, and I probably shouldn't say this because my colleagues at the centre in the NHS will be cross with me, but I think it's one message doesn't suit everybody. So I think when we were at the start of the crisis and we were in that broadcast mode, it was about, here's the message, from an NHS point of view about what you need to do and what you don't need to do. But I think as we move forward, we need to be much more nuanced in that. So for me, there's something about really understanding the needs of our different audiences, and what is it that they need to be focused on in terms of our journey towards recovery. And I think I would agree with both points that both of the Simons have made so far, around actually looking at who some of your key stakeholders are and who can be your ambassadors and engage with you to help be messengers for you with different groups of stakeholders that you've got. So again, I think it will be quite complex, but it's about really trying to understand who needs to know what in terms of messaging around recovery, but also who do we need to listen to for that learning, to really understand what it is that our different groups of audiences need from us as an organisation going forward.
So I'm kind of taking it from this conversation that we all feel that we're clearly still in a crisis, but the crisis we were at the beginning is not the same as we're in now. But we've also now starting to see some form of recovery take place, and I'm seeing this in the workplace. Some business as usual things start to pop up as well, where some bits of your organisation think, actually we're coming out of this now because I can start doing my normal job. So, and the challenge clearly for us is, how do we manage the messaging around that? Because if I'm a member of public and I'm now going out and getting my hair cut and having a drink, clearly I'm aware that I still can't do everything that I can do, but they want things to happen really quickly, don't they? They want it all to be over tomorrow. So how do we manage that? So so Amanda, would you like to kind of give us your view on that?
Yeah, I think I call it's having a tapestry of messages. So there'll be individual threads that will be very specific to specific circumstances, but together they create this picture that people understand. I think the key for me in all this is to have honesty and to inject as much hope as you can without false promises. I think it's one thing that we've been lacking, because it kind of, the way things developed, was any sense of hope for people. And the feeling that I'm sure everybody's picking up now is that it's gone from being, there's still some people who, like my mum and dad haven't been out of the house for 3-4 months and are still too frightened to go out of the house. So you've still got that going on at the same time as you've got lots of friends that are being made redundant and suddenly find themselves out of work from relatively what had been relatively secure positions before. It's going to get more complicated. There's no easy way of managing to deal with all that other than to try and be sensitive to what's happening and use the data and information you've got.
And Claire, that's exactly the challenge you've got, isn't it? Really, is managing the kind of I want to get out and go on holiday, and against you know, the challenge of making sure you're still wearing your face mask and all the other problems that, you know, people just want to get on with their normal lives.
Yeah, so hopefully you saw on Friday we launched our campaign called Enjoy Summer Safely, which is very much about you know, encouraging people to kind of go out and return to the things that they've loved and missed, but to do it safely. In the hub we do have the Health and Safety Executive. We've been working with people from kind of Visit Britain, so all the stuff around COVID secure workplaces, around COVID secure premises, so that your bars and restaurants. We've worked with Visit Britain on the whole We're Good to Go, which is a thing whereby bars and restaurants go through a checklist and they're able to put up on their window that they've gone through this process. There's the campaign around Know Before You Go, but very much as we're you know, for this summer period, it is about how do you enjoy summer safely. We know that some people, I mean, my parents are shielded, they haven't been outside their house in months, and for them it will be quite a lot longer before they feel safe to go because there's a higher personal risk. Whereas I've been working through this and there's a lower personal risk for me. And so I do want to get out and enjoy summer safely. And it's partly why I make the point about the Toblerone strategy, which is, you know, our strapline is about, you know, saving lives and livelihoods. And we need to kind of find that balance between those 3 points about how do we look after each one of those 3 incredibly important corners of our strategy.
That's the important point, isn't it? That's the point about being shielded, is that, you know, some people still have fear. There is still fear out there, whereas other people are the complete opposite. And so, with this kind of weird parallel universe that we're going to live in for the next year or so, if not longer, who knows, that we have to manage. There is a question up there from Kyra saying, is there any learnings from any more effective ways of getting to local people, as many councils and NHS organisations just broadcast at the best of times? Any new channels being used? Carrie-Anne, do you want to kick off with that one? So NHS has been mentioned.
Yeah, I wouldn't necessarily say that we've been using new channels, but I think we've been using some of our channels differently, and I think it goes to that point that is more around engagement and communication. So, for example, a number of our individual services actually have Facebook groups and Facebook pages set up where they've actually been using that as an engagement channel already. So rather than just broadcasting comms out through those channels, it's about asking questions and seeking feedback. So I think, you know, we haven't necessarily set up anything new, but we've been very mindful that we're not just broadcasting information, we're actually asking for people's views and then feeding those views back into the relevant services. And that has become something that we are more focused on, I guess, in terms of the recovery work that we're starting to plan, because we want to hear about what worked well for patients. So we moved quite a lot of our services to be digitally based services. And for a lot of clinicians, we found that people who were quite resistant have quite enjoyed using digital to engage with patients. But actually, we're starting to hear that for some of our patients, that's not been the right route to use. So I think that engagement piece now in terms of seeking feedback is really important, but we've been very digital reliant. So we're going to work with colleagues across our STPs, as we call them, so our system footprints, to look at using citizens panels and focus groups that I know Claire's mentioned, to do that piece of work across NHS and social care. So we're also not asking the same people for the same feedback multiple times.
That's very important. Simon,
can I just jump in with one other thought? It's just the other thing, obviously, about whenever you try anything new, is that people will try and make mischiefs with it. And I think what I found a wee bit disappointing through this process is any time that there's been a new intervention, be that a comms channel or, you know, test and all these things, at some point someone will try and either make merry with it or undertake criminal behaviour. So people phoning up people and saying, it's come to our attention that you've been near someone who's got COVID. We're going to get you a test. Can you just transfer £150? Or, you know, scam text messages, etc., etc. And I suppose, you know, that little cynicism there, but actually, whenever you try something new or more direct methods of communicating and engaging with the public, that we also need to work out how we do that risk mitigation for people, so that people are not making merry, particularly with the more vulnerable members of society.
We've only got a few more minutes left, so I know Simon BB, I'll call you. You wanted to quickly make a point.
Yeah, just that some positives that are emerging. I'm wearing my education hat now, but I'm conscious that school children have been really engaged in various ways, and obviously children of key workers have continued to be educated, but some of them at really quite young ages have shown quite a lot of understanding, because I think teachers have been getting really good information out, and they actually are influencers. I think that there's a lot that can be done through getting the right kinds of information through children, through families, through those social networks, if you like. And I've heard some really quite nice stories, and the rainbows in the windows are a lovely thing. So there's been some very positive communications which help safeguard as well. Okay, so we've pretty much come to the end of this now. Thank you everybody for taking part. I think one of the things I've learned is, just very quickly on that last question, is one of the things we need to do more of, and I think Simon Jones picked this up, is more engagement with residents and staff, and more feedback, because I've been working this game for quite a long time, and I'm always learning something new. And I think and I think Claire, you mentioned as well, is the learning from, although it's a completely and utterly negative thing, that it's a terrible thing that's happened, but actually the learnings we've got from this is actually going to be really helpful in ensuring that we're better communicators moving forward. And one of the lessons for me is that we need to get better at talking to our communities. And I'm not just talking about the community at large, it's those distinct communities that we don't normally talk to as well, because it's really valuable that we hear from them. But I think I think we'll probably all agree that depending what organisation you're in, you're at different levels of crisis and recovery. There is still a crisis taking place, but the level of the crisis is different from where it was when it first started to where we are now, because we've seen the drop in cases, but we can't be complacent, because we've seen, for example, Leicester, where there's been a flare-up, and potentially it's happened in other places, and we go straight into crisis mode again to manage it. But at the same time, we are seeing a form of recovery begin, be it in the high street for the public, but also in our organisations, and some business as usual as well. But we're still not at a place yet where things are normal. Am I right in that conclusion? Is there any last minute thoughts or disagreements or points to correct me on? No? Okay, that's great. So really, it's not really a clear-cut answer, I think, on that one. And it's kind of what I expected to hear. But I've really appreciated you finding the time to do this roundtable. I found it really valuable.